Hello student, today we will discuss about undescended testis. Otherwise it is called as a cryptorchidism. So the word itself indicates undescended testis means the testis is not descended to its normal position. Usually the testis is situated in the scrotum. Either one testis or both the testis is not descended to its normal position due to various reasons. Causes will be there. So you can see in a picture the scrotum is completely empty. There is no testis. So what may be the causes for this? Let me see. So before we could see the causes, normal mechanism we will say. See, you can see the testis in the abdominal cavity. Usually when the child in a mother womb as a fetus, the testis will be in an abdominal cavity. Okay. During later pregnancy or just before the delivery or during 9th month, the testis will slip down to its normal position, that is in the scrotum. That's a normal mechanism. But sometimes this normal mechanism is altered. The testis will not reach to the scrotum only. See, this is the inguinal canal. Usually the testis will be situated when the child is in a fetus in abdominal cavity only. There is a lot of mechanism will take place. Due to that mechanism, this testis will just slip down and it reach to normal mechanism. But due to various causes, it will not slip down and come and reach to its normal position. It will stay in a abdominal cavity or anywhere on the halfway. So what may be the reason or a causes? Let me see one by one. Okay, the first causes is a impairment of hypothalamic pituitary gonadal axis, block in hormonal pathway to stimulate the testis. Actually, what happened in a later pregnancy when a child is in a mother womb, like a later pregnancy, maybe in a 9-month, the hypothalamus is a part of the brain. In hypothalamus, pituitary gland is there. Pituitary gland will produce the hormone. That hormone will stimulate the testis to move downwards to its normal position through the inguinal canal. That canal will be there from the abdomen. It is connected to down part. Stimulus means it is a kind of a pulling force. But due to blocking this hormonal pathway, this normal mechanism will not take place only. There is no pulling force for the testis. So the testis will remain in a abdominal cavity itself. The second one is a anatomical obstruction along the pathway of descending inguinal canal. So you can see in a picture, see this is the inguinal canal, above this testis will be there. When stimuli come, it will push the testis and testis through this inguinal canal, it will slip down and it will reach to the scrotum. But if any obstruction or if any narrowing of this inguinal canal, the slipping of testis will not take place. Either the testis will remain there itself or half on the way or halfway of the inguinal canal. So see, you can see here on the way only, half only, it will stay there only. So that is the reason, due to obstruction. Third causes failure of intra-abdominal pressure. See, this mechanism, everything will take place at a time only, okay? See, when the stimulus will come from the brain, when the stimulus come, the push-up force force occurs. At the same time, intra-abdominal pressure will increase. So this pressure will also put the effort to pull the testis to normal position. So failure of intra-abdominal pressure, if there is no any intra-abdominal pressure due to various other causes, so the pulling force is absent, the testis will not reach to the normal position. Other causes are hereditary or a chromosomal abnormality, family history is there or any chromosomal abnormality, that is also leads to absence of one or both the testes. See, in some men, either they will born with one testis or both the testes also absent. If one testis means they can survive with the one testis, like in normal life they can lead, they can marry, they can have a child, everything. But both the testis is absence means they will have a infertility problem, okay? So this is the absence of one or both the testes means of course it will not reach. Okay, absence of one or both the testes is called as a anorchia. Very important. Put underline for that. For the 1 marks, they will ask. Anorchia means absence of one or both the testes. Another cause is a short spermatic cord and an artery. The normal length of a spermatic cord is a 22 mm. So means that the normal length, it is connected to the testis. So it helps to descend the testis to the scrotum. If the spermatic cord length is a very short, means only half of the inguinal canal only it will descend. It will not reach to the scrotum. So these all are the causes for the undescended testes. So what may be the clinical manifestation? Clinical manifestation means this can be diagnosed when immediately the child is born in a theater. The pediatrician will assess the baby. During the assessment only they will come to know. In OT itself, the child is born with either one testis or absence of both a testis or a undescended testis. Okay. Let me see the clinical types. There are mainly two types are there. One is a pseudo-cryptorchidism and one more is a true orchidism. So what is a pseudo-cryptorchidism or a retractile? Pseudo means it is a meaning is a lie. It is not true. Means here the testis is in a scrotum only, normal position. Due to various reason, for temporarily it is a pulled up. So when somebody see during a physical examination and or client itself when feel or parents are feeling their child scrotum is, they feel the testis is not there in the scrotum, but actually the scrotum is a descent. Okay, see, testis may be temporarily pulled from the scrotum to the inguinal canal or abdomen, especially during cold environment and during the examination when a proper supine position is put. During the examination, temporarily it is pulled out. So in such condition, now what can be done? Management through fingers, 3 fingers know how to place where there is this testis is there, by sliding the fingers from the inguinal ring towards the scrotum. Slowly, should not place finger over the testis. Testis is a very fragile organ, very sensitive. The damage may takes place. Just not over the testis, just away from the testis with the 3 finger, in a sliding movement you have to apply a pressure. So slowly it will slip to through the inguinal canal, it come and reach to the normal position. So that is a pseudo-cryptorchidism. The one more is a true cryptorchidism. True cryptorchidism is testis is located in the abdomen or inguinal canal, not descended at all. It is a true only because it is not reached to normal position. Rarely it can be seen in a perineum, femoral or in front of the symphysis pubis at the base of the penis as an ectopic testis. So you can see in a picture somewhere it will be in an abdominal cavity or a half of the inguinal canal. Sometime it may be under the perineum. So you can see in a picture it is away from the normal. It is called as an ectopic testis. They may ask for the 1 marks what is ectopic testis. Ectopic means away from normal position. Okay, so you have to write the testis is situated away from normal position. So these are the 2 types of a cryptorchidism, pseudo-cryptorchidism and a true cryptorchidism. So what may be the clinical manifestation? Absence of testis in the scrotum. That is, of course, as I said, immediately childbirth only the doctor will come to know when they are assessing. Not only the doctor as well as a nurse also. If not treated, complication with the impairment testicular function leading to infertility. Of course, this is in the needed treatment. Okay. Sperm forming cells are damaged when testes remain in a high temperature in the abdomen. Of course, the temperature of the scrotum and abdomen is entirely different. Abdominal temperature is a very high, little bit, and the scrotum temperature is a very low, less. So this testis can survive, and a testis will produce a spermatozoa as well as a testosterone hormone that only help for the fertilization and all. So it will survive in a only low temperature. Okay, so in a abdomen means it's not possible, so it has to descend and come to its normal position only. Otherwise the sperm forming cells are damaged when testes remain in a high temperature in the abdomen. Psychological problem will occur if only the child is born with one testis or both the testes is absent or testes remain in a abdomen or anywhere. Means, of course, as the child grows, the child will realize the anatomy and physiology, and there will not be the male character will not, because the testis will produce testosterone. Testosterone is a help for the male character to develop, and this testosterone and as well as the testis will produce sperm also. So many things male related. So when all this absence means, of course, as they grow, no, psychologically they will suffer a lot. How to diagnose? One is a physical exam. As I said, a doctor as well as a nurse in a OT, when child birth where occurs, there itself they will diagnose. Related history they can ask, okay, whatever from a chromosomal abnormality, hereditary, family history, all that things. Ultrasound, in order to know exactly where it is situated, ultrasound they will do. Laparoscopy, visualization. Laparoscopy means not a cut, through small hole left and right side they will made and they will insert a instrument scopy and they will visualize, okay, exactly where it is situated. Is it inguinal canal is a narrowed or a blocked, to find out the exact causes, okay, that without harming, damaging the testis. Hormonal assay means hormonal study also they will do. So lack of hormone also interfered in the descent of the testis. So how to manage? So spontaneous descent of undescended testis by 1 year of age. See, initially when child is born with this problem will not be a watch and wait, because spontaneously within a 1 year it will reach to the scrotum. If in case if it is not reached after the 1 year, the treatment has to be started, that is hormonal therapy with HCG, human chorionic gonadotrophin. That is a 250 units below 1 year. After the 1 year, 500 units between 1 to 5 years, 1000 units above 5 years twice a week for 5 to 6 weeks. Then one more is a LH-RH injection or a nasal spray, that is a luteinizing hormone releasing hormone, okay. So this also be given. So the client will respond for this hormonal therapy. So if poor response to hormonal treatment, then required surgery, okay. If the testis is not descend down only, means archidopexy, okay. Archido means testis, pexy means a repair. So they will open very carefully, because very minor, very delicate surgery this, and they will take out the testis and they will fix the testis into the scrotum. So while handling the testis, very carefully they will handle it, because the testis is very fragile. Absence of testis. In case of the child is born with absence of testis, no two testes also. In such condition, prosthesis like goalie-like two goalie-like prosthesis they will insert at 8 to 10 years of age to overcome emotional problem. As the child is grown, when child is realized he is born with the absence of testis and the major functions of the testis, all that things when he come to know, psychologically he may upset. So he may do anything also, oh, there is no life, all that thinking. So to tackle that, like prosthesis they will place. What are the complications of surgery? Yes, there is more chance for the atrophy of the testis. Atrophy means destruction of the testis due to damage of the testicular vessel. As I said, it's a very delicate organ. They will handle very carefully. If little bit harsh handling means there is chance for the atrophy of the testis. Okay, these are the medical and surgical management. So as a nurse, what is our nurse's responsibility? So nursing assessment, history collection will be there. Physical examination will be there. So after the history and physical examination, you will come to know few signs and symptoms. So based on that, you have to form if patient is undergoing for the surgery means pre as well as a post-operative, and you have to counsel the parents, because parents are worried a lot thinking about the child future. You have to counsel, you have to guide the parent, and you have to answer whatever question they are asking, but in a very rational way, but not in a hurting way, okay. Very rational way you have to answer, and you have to guide them for the follow-up, okay. So hope student you understood. For the nursing management, always as a medical student, nursing student, you have to refer the book, okay. By referring, you have to try to gain the knowledge. So refer the book for every nursing management, every disorder, okay. So thank you. So remaining portion I'll take in another video.